Good afternoon. Thank you, Governor. We greatly appreciate your leadership. And to Drs. Klein, Kemmerly, O'Neill, Mason, and Ms. Sutton, thank you so much for being here. And on behalf of the Department of Health, we wanted to thank the teams and the medical staffs and nursing staffs and support staff that you represent, knowing that after a very, very long year, this is likely some of the hardest points that they're going to go through right now. So we would ask you to convey our gratitude back to your teams for what they're doing now and what they have done for Louisiana over the past year. Louisiana finds itself yet again on the leading edge of a very dangerous surge that is going across the country. And as the governor noted, we are both the #1 state in the country now for COVID-19 in terms of new cases. We're also at the highest point, or just about, we have ever been in terms of COVID-19 in Louisiana. And that's an uncomfortable thing to say out loud, and I think many would find it a shocking thing and almost be in disbelief that this far into the pandemic, this is where we will find ourselves. But I hope after today's comments, folks will have a clear understanding of the picture that we're in, what our hospitals are facing, what is at stake, and what we as a community need to do to turn it around. I'm going to go over some numbers that we share every time that we get together just to catch people up as to where we are. This is a familiar graph. On the top left, you see COVID-like illness. That's the percentage of ER visits that are attributable to COVID-like symptoms, for example, cough, fever, shortness of breath. As of today, 13.4% of every ER visit in the state is somebody seeking care for these type of symptoms. That is the highest mark it has been at any point in time during the pandemic. On the top right, you see incidence. This is the number of new COVID-19 cases diagnosed every day, smoothed out over a 7-day average. As of today, we are averaging 88.2 new cases per day per 100,000 residents. That is the highest point it has been in Louisiana at any point prior in the pandemic. On the bottom left, you see the combo graph with the orange bars on the bottom representing percent positivity of all tests being conducted. As of this week, 13.2% of all tests being conducted are positive. That's the highest number it's been here since the first week in January. And the purple line above is testing volume. As you would understand, testing volume has gone up notably the past couple of weeks, and we ended the month of July with over 500,000 tests being conducted. And of most concern to us, on the bottom right, you'll see a graph representing the number of COVID patients hospitalized throughout the state. As of today, we are at 1,984 COVID patients hospitalized throughout the state. Our first surge in March, April 2020, we peaked at 1,991. Our second surge, which was about a year ago to date, we peaked at 1,600, which we've clearly surpassed now. Our third surge, which up until this surge was the largest one, Christmas and New Year's surge, we peaked at 2,069 hospitalized patients. We are on track to exceed that mark tomorrow. And I have every shred of confidence, unless something miraculously happens, that tomorrow we will have the largest number of hospitalized COVID patients throughout Louisiana than at any point prior in the pandemic. We are also seeing younger patients get hospitalized, and we are unfortunately seeing younger patients die with the Delta variant. The average age of COVID fatalities has gone down 10 years since the start of this year. It was 75 at the end of 2020, and as of this month, it's now 65. And more concerning than that, over the past month, the number of COVID deaths in individuals less than 40 years of age has increased 566%. That's 566%. I expect the speakers that follow me will share the challenges being faced by their hospitals and what that means for their patients and for the communities that come to rely on having quality care available when they need it. I'll tell you, this battle has shifted as the pandemic has gone on, and you'll remember in the beginning we were worried about PPE and ventilators. Thankfully, we have enough of those right now. We later were worried about physical space. The key limiting factor right now is human resources. It's staffing. And as the governor shared, this is a national issue. We're about 6,000 to 7,000 nurses short in Louisiana, even before this surge. And hospitals are having to ask much more of their medical and nursing staffs who are already very tired and stretched very thin. I want to be clear, this is primarily a staffing issue. We are short in human resources. To that end, we have made rather unprecedented requests to our federal partners. We've asked for federal assistance in the form of disaster medical assistance teams, or DMAT teams. The first one of those teams arrived in state over the weekend and is being onboarded right now. We will make additional such requests, but that is a very limited resource. And we do not expect the feds to be able to provide us all the staff that we need. It's also a rather extreme resource. You typically don't see these DMAT teams outside of extreme natural disasters, hurricanes, earthquakes, and so forth. To have a federal disaster medical assistance team on the ground right now providing staffing augmentation to a civilian hospital is quite the sight, quite the marker of how severe this situation is right now. Move on to the next slide, please. I wanted to review what we know already, and this is the result of 16, 17 months experience of this pandemic, some of those months being the leading state, I should say. At this point, it is unquestionable that universal masking has proven to be an effective strategy to reduce the community spread of COVID-19. Repeated studies have shown that when localities institute universal masking, they see the transmission of COVID-19 go down. Is masking perfect? Of course not. Nothing is. Will it prevent COVID 100% of the time? Of course not. Is it highly effective when employed at the community or statewide level? Absolutely. Absolutely. We also know without any shred of a doubt right now that vaccination significantly reduces one's chance of becoming critically ill or dying from COVID-19. From the best data we have right now, and again, with the Delta variant, data is coming in very quickly, and some of it from Louisiana itself, because we are really one of the leading edge states right now, if not the leading edge states. But from the best data we have right now, when you get vaccinated and you are fully vaccinated, you have a 25-time reduction in your likelihood of being hospitalized from COVID-19 and a 25-time reduction in your likelihood of dying from COVID-19. Vaccination confers immense benefits upon the individual who gets vaccinated. Next slide, please. Over the past week or two, there has been new information learned about the Delta variant. And this, as the governor has said, changes the game. We now know the Delta variant is at least twice as transmissible as the original strains of COVID. At least twice. On average, if someone is infected with Delta, they will then infect anywhere from 5 to 8 or 9 additional people. That's a much larger spread than we had seen previously. At this point, we know that Delta variant is causing large, rapid increases in infections that are compromising the capacity of healthcare systems to provide care, never more so than in Louisiana right now. But other states are experiencing this as well, and I think we'll get to where we are within the next 1 or 2 weeks. We also know that while vaccination reduces one's chance of becoming infected with COVID-19, if you are fully vaccinated and you do become infected with COVID-19, you can still relatively easily transmit the virus to other people. This is new with Delta. We looked hard at very recent data that came in this past week from CDC morbidity and mortality review reports and preliminary data from both Singapore and Wisconsin, showing that if and when fully vaccinated people do become infected. And I want to say, if you are fully vaccinated, it's less likely that you will be infected, about 8 times less likely that you'll be infected if exposed. But if you do become infected, you likely have as much virus circulating in your body, at least in the early days, as someone who's infected and not vaccinated. Likely inferring that you can spread that to other people as easily as someone who is not fully vaccinated, at least until your antibodies kick in a few days later. This is new with Delta. And this is why with Delta, unfortunately, when we are in a surge, which we are now, it is not enough to say you only need to mask if you're unvaccinated. Because we are in a surge, and because we now know, based on the best data to date, and some of it very recent data, that breakthrough cases or people who are vaccinated yet still infected have high viral loads and can likely transmit the virus easily to others, that universal masking right now is what is needed. I want to be very clear. Getting vaccinated remains highly valuable, remains the single greatest thing you can do to protect your own health. 25-time reduction in your chance of getting hospitalized with COVID, 25-time reduction in your chance of dying from COVID. But if you do become a breakthrough case, you are, as best as we can tell from the data right now, just as likely to spread that virus to someone else as compared to someone who's not vaccinated. Next slide, please. To review what people can do to protect themselves and protect their others right now, and nothing of this is new, because we have a lot of experience with this, but I think it's helpful to go through these items one more time. Even though it's hot outside, and today, storming, being outside is safer than being indoors. Transmission is much more likely if you're indoors. If you can be outside, given the weather right now, it's much safer from a transmission standpoint than being indoors. Crowded settings are risky, whether it's indoors or outdoors. If you're in a crowd, that's a high transmission risk environment. You should get tested anytime you believe you have been exposed to COVID-19, regardless of whether you are vaccinated or not. If you believe you've been exposed, get yourself tested and do it again 5 to 7 days later. And I'll tell you, if you need help finding a place to get tested close to you, 2-in-1 is probably the best place to start. Practice good hygiene, hand washing, cleaning of hard surfaces. We don't believe this is the dominant way that COVID spreads. We believe COVID spreads primarily through respiratory droplets, but it still can technically spread through handshaking or touching surfaces. So frequent hand washing, hand sanitizer is always a good practice. Understand your risks and the risks of your family members. If you or your family are high risk by virtue of age or underlying health condition, these measures are all the more important to you because the stakes are all the more higher. The consequences are all the more higher should you or your family get sick. And we would encourage individuals and businesses to work remotely wherever that is possible and practical. If your business or your organization has the ability to conduct its work virtually or remotely, now's the time to do it. I'm going to make a few more asks of you. Number one, while we are in this surge, do not blow off any symptoms, however mild they are. COVID can present with the classic symptoms of cough, fever, shortness of breath. It can also present with relatively mild symptoms that you can easily confuse for allergies, sinus infection, runny nose, something you picked up from your kid who's in daycare. All of those things can easily be COVID, particularly now while we're in a surge. If you have any symptoms, no matter how mild, even a sore throat, even a runny nose, even sinus congestion, go and get yourself tested. Limit your contact with other people until you do so. I'm going to ask you to avoid emergency departments if possible. And don't mistake me. If you are sick, really sick, go to the ER and don't hesitate. But if you have very mild symptoms, or if you just need a test, I'm going to ask you until the hospitals get some more breathing room to find other places to receive those services. Testing can be found at most large commercial pharmacies and a number of other sites. 2-in-1 is the best place for that. If you have mild symptoms, if you have access to be able to call your doctor or medical provider, or perhaps go to an urgent care, Those are better options right now while hospitals are struggling to meet the demand of very, very sick patients. But please don't misunderstand me. If you are very sick, if you're having a hard time breathing, if you think you're very sick, do not hesitate to go in to seek care at a hospital. And the last thing I will ask you is take this masking order seriously. We did not come to it lightly. I'll note that if we intend to prioritize the things that are important to us, like keeping our kids back in school in person and maintaining our growing economy by keeping businesses open, masking is the best way to ensure that. So please take this masking order seriously, both in your personal lives and your professional lives. You know, if there's any silver lining in all of this, it's that our vaccinations continue to increase. And we have almost about fourfold increase over the past couple weeks. A couple weeks ago, we were at 2,000 new vaccine initiations a day, and now we're at 11,000 vaccine initiations a day. I think because people rightfully are scared of looking around and seeing people get sick, and they don't want to get sick. And that's the right call. And each of the 11,000 people that chose to get vaccinated yesterday changed their mind, because they obviously hadn't done so until now, and that's okay. It's okay to look around and say, you know what, it's time to get vaccinated now, and change your mind. I would encourage people to do that. I'll remind people this is our fourth surge, which means we've been here 3 times already. And we know precisely how to get our way out of this. And it's by masking, distancing, staying apart from people, being outdoors if you can. We know exactly what we have to do. We've done it 3 times already, and we surely will do it another time. But I do think it'll be a challenging few weeks. I'm going to ask Dr. Klein from Children's Hospital of New Orleans to come up and share some perspective of what you're seeing in your hospital.